Hi, my name is Rafael Bejar. I'm a physician scientist at the University of California, San Diego, and I've been asked to comment about immunotherapy in MDS. Specifically, how can immunotherapy be used in MDS? And I'll start by saying that we already use immunotherapy in MDS on a regular basis. That's the nature of what a hematopoietic stem cell transplant is. While we are giving a patient donor stem cells or donor bone marrow cells, those cells not only reconstitute the hematopoietic system, they reconstitute the immune system as well. And the reason that that therapy can be curative is that the immune surveillance from the donor cells can actually target and remove all of the mutant MDS cells that are left in the body. Now, that therapy is effective, but unfortunately not available to everyone with MDS. So we would like to use the same principle in a broader number of patients in perhaps a way that is both less toxic and less costly. So we have several approaches like that that have been tried. And the most promising, at least on paper, are the immune checkpoint inhibitors, since they have been very successful in patients with other kinds of cancers, particularly things like lung cancer, melanoma, and so on. And what the immune checkpoint inhibitors do is they take the brakes off the immune system. So if the immune system is capable of recognizing a tumor, but is somehow being inhibited by signals that perhaps the tumor is sending itself, blocking those inhibitory signals can take the brakes off and allow the immune system to then recognize the tumor more effectively and eradicate it. And several drugs that are checkpoint inhibitors have been tried in MDS. Now, as single agents, they haven't had overwhelming activity. However, they are starting to be combined with some of our existing MDS therapies, and in combination, show greater activity. We still need to see more advanced clinical studies to compare the combination of immune checkpoint inhibitors with drugs that already we use to treat MDS as single agents. And if those combinations show better efficacy, they might represent a new means of inducing an immune response against tumor cells in MDS. Now, along in parallel are several new drugs, including drugs like sabatolimab and magrolimab. These are antibodies that also function as checkpoint inhibitors, targeting slightly different agents from those already approved drugs that I mentioned. And these show early promise in MDS patient studies and are going on to phase 3 studies now. Now, beyond checkpoint inhibitors, other options for engaging the immune system include vaccines against MDS-like cells. And vaccines show the immune system the abnormal proteins that MDS cells might contain and allow the immune system to then recognize and mount an immune response against them. And early vaccine trials against a combination of antigens, including embryonic antigens or tumor-specific antigens like WT1, have been tried and have been shown to generate immune responses in patients with MDS. And we look forward to more advanced studies that will show us whether or not these are actually effective or whether they need to be combined with other therapies. Along the lines of vaccines are dendritic cell vaccines, where we actually not just put in the abnormal proteins, we actually put in the cells that normally teach the immune system how to recognize those proteins. So this is a form of cellular therapy that is also being tried in MDS. And finally, I think one of the most interesting new topics is the idea of using manipulated cells, like genetically modified T cells, as the drug, as the therapy. And in these examples, we take T cells out of the body, immune cells, modify them so they can now recognize tumor-specific antigens and put them back into the body. And this approach, called the CAR T cell approach, has been particularly effective in patients with B-cell malignancies, things like lymphoma, for example, or CLL, chronic lymphocytic leukemia. We haven't yet had that kind of success with diseases like MDS, in part because our targets for these diseases are not as mature. We don't have great targets for these just yet. However, I think as we get better at doing this and learn about how to do this in a more specific way, these options will become available for MDS patients as well.